Okay, guys, I think we're going to make a start now. It's a couple of minutes after half past, so I think anybody who's going to be coming has probably joined in now or is just about in the process of joining. Welcome to this webinar. It's the second one we're doing today. The first one we did was counter assistance in the morning. This is the 8:30 one, which is the one for pharmacists. My apologies again. We normally do these at 8 o'clock. Because of the tube strikes, my other half was actually working quite late, and I had to put the kids to bed. So that's the reason why it's half an hour delayed. It normally is at 8 o'clock. So I don't intend to take too much of your time up. I'm hoping that we should be finished by about 9 o'clock-ish or so, give or take how many questions there are. For those of you who don't know me, my name's Stephen. I'm the Head of Professional Services here at Pharma Plus, and I've got the pleasure today to really talk to you about basic open-angle glaucoma. It's a rather unusual subject. One of the reasons why I chose it was basically a good friend of mine was actually diagnosed with glaucoma, probably around about probably about a month or so ago, and hence I thought, well, this is quite a nice topic to choose, especially because the fact that my experience with pharmacists as well, most pharmacists don't know too much about it either. And there's general reasons for that as well. I mean, it's not something that generally comes up very often. It's not something you can do very much about unless you're an ophthalmologist or an optician. So really, the medicines management opportunities in terms of conversion of therapy to different types of eye drops or therapies is quite limited. I mean, I've got a lot of experience myself with GP practices, and very rarely, if ever, if I can remember, we actually worked on glaucoma as an audit. So it just gives you an idea of how difficult this particular subject is. So my idea for today is not really to go over too much detail about the therapy, about what you should be doing, etc., because very little you can actually do. But really it's to give you an idea of what the condition is, what the patient has had to go through in order to be diagnosed with glaucoma, and really some of the more public health related issues that could crop up. So the therapy is probably the last thing on my mind at the moment, but we will quickly go over it for completeness. Okay, so that's a basic introduction. Let me just put this up. Bear with me a second. I will. How do I do this? Bear with me a second. I did do it earlier on today. I can't remember. Okay, I can't remember how you do it. I think this is on page. Nope, that's it. Okay, no, that's the one. That's what I wanted. No, it wasn't. Okay, anyway, I'm not going to bother too much about it. Basically, what I wanted to do is wanted to sort of like do it with full screen, but I'll do that later. It's not important. Okay, for those of you who have attended these sort of webinars before, it's slightly different. Or those of you who haven't, I should say. I try not to go over PowerPoint slides. I don't like them very much. And not only don't I like them, I think it gets rather boring as well. We tend to use a format called a mind map, which is what this is, and as you can see, it sort of produces a lot of information in one space. It's quite easy to read as well, and not only that, but it also gives we can actually send it on to you as well. So if you do want it at the end of this webinar, I'm happy to forward it on to you as well. If you do have any questions, by the way, there is a chat function. Let me type something in here, bear with me. Here it is. Okay, so if you've got any questions, feel free to ask me. I might not necessarily know the answer, but I will certainly find out for you if need be as well. So let's make a move on. That's the introduction done. I've been yapping on quite a bit now. Okay, so open angle glaucoma. Now, the first thing I wanted to show you was basically this. This probably takes you back to your school days or even university days, but I'm sure you'll recognize it as part of a diagram of the eye itself. And so let's quickly go over the general structure. And then the idea is that a lot of the stuff that we will be talking about will be directly related to this diagram here that you can see here. So what I'm going to do is I'm going to leave it on for the the length of this webinar. So let's quickly go over it. So in terms of the eye, you've got the cornea, which is the outer layer of the eye of the eye itself. You've got the iris and the eyelid. You've got a few eyelashes here, which looks as they're quite long, aren't they? Very nice. Anyway, you've got things like the trabecular meshwork. Now, what this is quite an important function, especially in glaucoma, because this little bit here is called the aqueous humor, and the water drains out through the trabecular meshwork. As you'll soon see, what you'll soon find out is that the glaucoma itself is caused by an increase in the pressure. In other words, by the fact that that fluid inside can't necessarily drain out, and therefore it stays in the eye, it keeps on pouring out and increases the pressure in the eye there as well. So that's one of the main issues with open-angle glaucoma, and a lot of the drug therapy you'll see is designed to get rid of that water into the trabecular meshwork. Now, you've got things like the suspensory ligaments, which basically hold on to the lens, and this is another important part, the macular and also the optic nerve. What you'll find is that when pressure builds up, the optic nerve itself could be damaged quite severely, and if the optic nerve is damaged, you're going to lose sight. Okay, so this is is a very basic diagram, probably GCSE. Oh, sorry, probably GCSE type diagram. But it's good to know. We've also got the conjunctiva here, which is sort of like a layer of cells across the eye, which I'm sure you're well aware of. It could become infected, it could become reddened and sore and give conjunctivitis. And this bit here is called the vitreous humor, which is sort of jelly-like substance within the eye, which holds the structure of the eye itself. So that's a general overview, but the most important part that I want to discuss with you, this bit here, which is the aqueous humor, the trabecular meshwork, which is here, the sclera, which you'll see why that's quite important as well, and the optic nerve. Those are the main parts that I want to concentrate on. Okay, so let's talk about what glaucoma is. And I'll quickly, that's better. Okay, you can probably see that better now. Okay, so basically, what is glaucoma? It actually is damage it causes damage to the optic nerve in the back of the eye. Now, obviously, if the optic nerve is damaged, you're going to find it very difficult to see. You could actually go blind. It's usually caused when there's an increase in the pressure within the eye, and as we discussed earlier, it tends to be due to fluid accumulation. It can lead to visual loss and blindness, and treatment can actually slow down this progression. So it's actually quite important. It's quite important to ensure that you catch this early. Now, this is quite an important thing here, and this is one of the things that I've starred. It's simply because of the fact that you as pharmacists can actually help find patients and inform them of this. You might not necessarily be able to help them with the therapy that much, but you can certainly sort of like help them to discover particular patients who may not necessarily be having regular eye checks. So all patients aged over 30 to 40 years should have a regular eye check, which includes a measurement of the eye pressure at least annually. Okay, so that could be one of the things that you as pharmacists could certainly help with your patient population. Okay, so that's that part of the thing, the glaucoma, sorted out what glaucoma is. Now, believe it or not, there's various different types of glaucoma, and the one we're concentrating on at the moment is, as you can see on the actual thingy itself, is chronic open-angle glaucoma. Now this particular condition, okay, it's also been called chronic glaucoma or primary open-angle glaucoma. All right. Now this is the reason why we've gone into this more than the other types of glaucoma is that it is the most common type of glaucoma you're likely to get. It develops very slowly as well, and this is quite important because before you know it, a lot of your peripheral vision, a lot of your sight has actually disappeared before you actually notice it, and hence the reason why you need to get your eyes checked on a regular basis. Now, the term open angle, open angle even, refers to the angle between the iris and the sclera, which is normal, unlike the other types. So basically, that's the sclera there. The iris is there. Okay, the angle between the two is normal. In other types of glaucoma, it's not. It may not necessarily be normal, as we'll talk about in a minute. So that's the general thing about open angle glaucoma. Let's move on to the next bit. Acute angle closure glaucoma. All right. Now this one is different from open angle glaucoma. I'm not going to focus too much on it because it's more uncommon than the other types of glaucoma. But the angle, remember we talked about the angle between the sclera and the iris. In this particular glaucoma, it's narrowed. There tends to be a sudden increase in pressure within one eye, and one eye tends to become very painful and very red as well. So while with open angle it tends to be sort of like a gradual process, as you can see here, this one tends to be more sudden, okay, and it becomes painful very quickly. So if that happens, then again it's a referral to the GP or to the optician. Okay, secondary angle glaucoma. There's other types of glaucoma that tends to be caused by eye injuries. And finally, there's another type of glaucoma called congenital glaucoma, which is present at birth as well. But for the purposes of today, what we're going to focus on is mainly on this one here, the one with the tick in it, which is an open angle glaucoma. But this just gives you a very sort of like overview, a brief overview as to what glaucoma actually is. Okay, so we've gone over the three little bits, and you can see now why the diagram of the eye is probably quite useful to have up. Okay, what happens in open angle glaucoma? Okay, now this is why this diagram is going to be very, very important, and it will certainly hopefully put this into context. So what happens is open angle glaucoma is that the trabecular meshwork, which is here, becomes blocked or partially blocked. Now, as with any drainage system, those of you who are plumbers around here, if you block something, what happens? There's going to be a build-up in the aqueous humor around here. If there's a build-up in the aqueous humor, what happens? You're going to get a lot more water building up, and the pressure within your eye will then increase. Okay, so this is what these three parts here: a partial blockage within the trabecular meshwork, restriction, which restricts the drainage of the aqueous humor, which is the water in the eye. The aqueous humor builds up if the drainage is faulty and increases the pressure within the eye. And what this happens here, what happens next is that it damages the nerve fibers, it damages the retina, running from the retina, and hence you will then, over a period of time, start to lose your sight. Progress, it doesn't have to happen at the same rate in each eye. There's often one eye progresses more quickly than the other, simply because of the fact that each eye has its own separate trabecular meshwork. Therefore, if one is blocked and one may not be as blocked, you can have different rates. And finally, other factors such as poor blood supply may make the optic nerve even more sensitive to pressure as well. If you've got cardiovascular issues, if you've got any form of poor blood circulation, it can make it even more sensitive. So hence even more of a reason for you to get yourself checked out or get your patients checked out if you suspect this. Okay, so we've gone over a reasonable amount. Hopefully by now you should have a fairly good idea of the process that occurs within glaucoma itself. Who gets it? Now, this is when I read about this struck me quite a bit. Now, in the UK, about 1 in 50 people aged over 40 have glaucoma. Now, if we can imagine that there's around about 50 to 60 million people in the UK alone, and I don't know, let's say for example 30 or 40% of them are over 40, you've got quite a few hundreds of thousands of patients who actually have glaucoma, and there's probably a lot of people out there who haven't been diagnosed as well. Now this rises to about 1 in 10 people over the age of 25, and it is actually unusual in people under the age of 35. So hence, at around about 35 onwards, you would probably suggest to your patients, get your eyes checked on a regular basis. Now, what type of people tend to get glaucoma more often? Those who have a family history of glaucoma, and as we'll see later on, there are specific patients, these type of patients who get optical exams for free. Patients who have got very short-sightedness, patients that have diabetes. Remember, we talked about the blood supply issues and diabetes, the capillaries and the microcirculation is affected quite significantly. And there's almost certainly an element of genetics involved, especially with the family, but also patients who are African or Afro-Caribbean origin tend to get this more often as well. All right, so just to summarize quickly, we've gone over the eye, we've gone over what glaucoma is, we've gone over the different types of glaucoma, we've gone over what happens in glaucoma, and we've also discussed who gets it. Let's move on to the next bit. There's not too much to go, as you can probably see. You're probably sighing there and thinking, thank God. Let's go on to the symptoms of it now. Now this is where the problem starts. There's no symptoms. Okay, very few symptoms. All right, and this is where the problem starts because there's very few symptoms in open-angle glaucoma. What you'll tend to find is patients will not realize they have it, and that is why the tests in the eyes are so important. Most people with glaucoma do not notice problems until quite a bit of visual loss has occurred. It then gradually causes blindness, and hence the reason why screening for glaucoma is extremely important. All right, so I'd like to give you a massive list of symptoms there. This is what you need to watch out for. But again, as pharmacists, it's very difficult even to, you can't diagnose these patients. You can't, really affect their treatment that much. But what you can do is you can help to identify patients who need to be looked at or need to be referred on to the optician simply because of that they haven't had an eye test. So who should be tested? As we discussed earlier, everyone aged over 35 to 40 should be tested. So it wasn't every year, so it's at least every 5 years, but probably might be better to do it every year, every other year. A check should be, if you're over 50, you should have a check every 2 to 3 years. Now, there are patients who get a variety of free tests as well. An example of which is if you are over 40 with a first-degree relative, that is a mother, father, brother, or sister with glaucoma. Now, if you have been found to have glaucoma, you should tell your close family members so that they can be tested as well. All right, and that's another thing that you could possibly help with as well. Okay, so that's who should be tested. Let's talk about the test itself. I'm sure you've all been to optician. I know I'm pretty short-sighted myself. I'm very short-sighted in actual fact. Well, not that short-sighted. I mean, I can't see too far in front of me. But one of the things they actually do is they take the pressure of your eye, and they sometimes put a puff of air into your eye and measure your pressure in the eye that way. So so here are a variety of different tests that can be employed. All right. First of all, they examine your eyes using special light and a magnifier called a slit lamp. Now, in glaucoma, the optic disc. Now, I'm sure you've seen pictures of it. I haven't got one in front of me at the moment. But if you look on Google and you look on some of the retinal screens, you'll actually see that the optic disc takes on a typical appearance, and this is said to be a cupped appearance. The pressure in your eyes, the intraocular pressure, will also be measured, and that's what that puff of air is. The thickness of your cornea may also be measured. A special lens may also be used to examine the drainage area, and your field of vision may also be tested. But remember, I remember when I used to have my eyes tested quite often, they have a little pen which they will like tell you how far can you see behind you, and that's basically the reason why they employ that test. So there's quite a few tests that they can employ. Now, this is the treatment bit to it, and this is probably the one which you're most familiar. and it's probably the one which I'm going to involve the least amount of time. And the reason being is that there's very little you can actually do in terms of therapy for these patients. And as I said earlier on, I've worked in GP practice for quite a long time, and to be honest with you, very rarely have I actually worked with glaucoma type audits. There's different types of treatments that can be employed. There's eye drops, there's tablets, there's laser surgery, and so there's laser therapy and there's surgery as well. Let's talk about the eye drops. Let's just put these back. Okay. So there are several different ways in which they work. All right. There are drugs that reduce the amount of aqueous humor that you make. Remember, the aqueous humor is the water. If you reduce the amount of water that you make, it will reduce the pressure accordingly. We'll go into some which sort of drops these are in a bit. I say beta blockers are the most common types of drops we use, and I'll go over different types of drops you'll get in a minute. Okay, there are also drugs that increase the drainage of the aqueous humor. Okay, for example, prostaglandin analog drops. Remember, if there's a lot of water in here, if you can increase the amount that is drained, you will reduce the pressure here as well. Okay, now some of you may have actually come across myotics, things like pilocarpine. Those are generally not commonly used anymore in open angle glaucoma. Let's talk about the beta blockers and the ones which reduce aqueous humor. Okay. The beta blockers, examples of which include betaxolol, you've got cartolol, levobutanol, and timolol as well. Now, there are times when that might not necessarily be a good idea to have those, and particularly, for example, if you've got asthma or heart disease, for example, these types of drops could actually exacerbate asthma. If you remember, even if you install eye drops and you've got a beta blocker, not necessarily a good thing to do. You can exacerbate an asthma attack. So if in these conditions, these particular drugs are not suitable, you could use these different types of drugs here. You've got a type of drug called the sympathomimetics, and you've got the carbonic anhydrase inhibitors. And I'm sure these ones you have almost certainly come across. You've got things like brimonidine. I can't even pronounce that one. I always remember, for some reason, I remember Apache, a helicopter. I can never remember that particular. Apraclonidine. I've actually said it. There you go, apraclonidine. And you've got the carbonic anhydrase inhibitors. You've got the brinzolamide and you've got the dorzolamide as well. Okay, so if beta blockers aren't appropriate, these different types of drugs could be used. All right, the different types of prostaglandin analogs. All right, again, you have almost certainly come across these. All right, we've come across all the prosts. Yeah. Now, bearing in mind, if I open this one up again, you'll see that there is the possibility that you can get combination drops, timolol and latanoprost, for example. So you can actually get combination eye drops that work in both ways. And now you're probably beginning to understand how these particular drugs work together in combination. They'll work to reduce the amount of aqueous humor being produced and also increase the drainage at the same time as well, thereby reducing the intraocular pressure. All right, so you can actually see that there's various different combinations that you can use as well. Now, if for whatever reason eye drops, there is also, I forgot to mention the issue of preservative-free drops as well. You know, I mean, you probably yourself know the cost of these drops as well, but at the end of the day, if people are allergic to preservatives in these eye drops, then you will need to give preservative-free eye drops, or they will need to be prescribed that. The cost of going blind is significantly more than these sort of like preservative-free drops. All right, let's go on to tablets. Now, if the eye drops aren't working, what you can do is you can use a tablet called acetazolamide. There is another one, but I'm going to stick on acetazolamide. And again, like, where is it? Sorry, bear with me. Bear with me a second. Yeah, like these ones here, like the carbonic anhydrase inhibitors, which is this bit here. what it does is it reduces the amount of aqueous humor that you make. It does have some troublesome side effects though. Not particularly nice one to use. There's blood disorders, rashes, you get something called the sulfonamide reaction as well, which isn't very pleasant either. So this particular tablet, you probably won't see it too often. You might see it a few times a year in a reasonably busy pharmacy, but it's probably one which is not something that you'll see very often. But again, as you can see now, you can see the reason why it isn't particularly very widely prescribed, because the eye drops are the first line in defense there. Okay, so we talked over eye drops, talked over tablets. Let's go over laser therapy. Okay, if eye drops and the tablets aren't, if the eye drops generally aren't helping to lower your eye pressure enough, what you can do is you can go for laser therapy, and what it will do is they will burn the trabecular meshwork. So it will physically burn the trabecular meshwork around here, all right? And as a result of that, it will improve the draining of the humor, the aqueous humor. So in other words, the water there will pour out, okay? So that's what the laser therapy is about. And finally, okay, surgery, which is probably not the nicest thing to go, especially if you've got a knife coming at you in your eye. This involves creating a channel from just inside the front of your eye to just under your conjunctiva. Now, I'm not an expert in this, but I certainly wouldn't want to go through surgery if I could help that. But it gives you another option there. Okay, now I'm looking at the time. It's coming up to 9. We've almost finished. You'll be thankful to hear. Driving. This is the last bit to it. Now, this is another thing that you as pharmacists could certainly help with. Patients newly diagnosed with glaucoma need to be, the DVLA needs to be informed. Very similar to insulin-using patients. If they're driving heavy goods vehicles, the DVLA will need to be informed. But this does not necessarily mean a ban from driving. What it basically means is that you will need to go for more regular tests and to ensure that you are safe for driving. So a lot of people may be deterred from doing that, and I have a feeling that they are required, and that the doctors may be actually required to inform DVLA as well. But that doesn't necessarily mean a ban in driving. So hopefully, if you are diagnosed with glaucoma, that doesn't necessarily mean that you will be banned from driving. Okay, that is what I really wanted to discuss, and I'm like hit exactly on time, which I'm quite happy with. What I would like to do now is just sort of open the floor. If there's any questions that you want to ask, I might not necessarily be able to answer them here and now, but I can certainly find out. If you've got any questions, you've got the chat box there. If you want to ask a question, go ahead. And just hang on for a minute while if anybody doesn't want to do that. Okay, I don't think anybody wants to do that. Nobody wants to talk to me. I think we're all probably very, very tired. Okay, guys, then I'll take that as a hint there, yeah? All right. If any of you do want to contact me, that is my email address there, different@pharmacistsltd.co.uk. That is my direct telephone number as well. If you need to talk to me about this or anything else, feel free to contact me. Just a few things then while we finish off on the webinar, unrelated things as well. We are doing a series of flu training events as well. I'm just planning that at the moment. It's likely to be at a very, very minimal price for you lot. In actual fact, we're thinking about even doing it for free, but there may be a slight charge involved, very, very, very minimal charge. Remember that in the London region, there's not going to be just flu training. There's going to be other types of vaccinations that they're going to be commissioning. So it could be pertussis, there's pneumococcal, there's a few others as well. So it's quite important that you attend those events, and we'll be sending out some more details of them very, very shortly. Also, to let you know as well that we are just about to launch another deal with Buttercup's training for pre-registration training, but we've managed to negotiate a fantastic rate with them. Normally, Buttercup's charges around about £1,200 per pre-reg trainee. We're going to be promoting it at £975 per trainee. So, and it beats any other deal that we've got with any other pre-registration provider. And being Buttercup as well, they are fantastic too. I know them very well. So please be on the lookout tomorrow for an email on that as well, because we're launching it tomorrow too. Okay then, I'm going to call it a day today. I am sure you've got families and kids to go back to, like I have. I can hear my one asking me to come upstairs now. I think she's drawn me a card or something. I don't know what it is. But I'm going to call it a day now. And thank you very much for coming along. I hope you found this useful. If you want the mind map, drop me a line and I'll forward it to you. If you want a copy of or recording of this webinar again, I'm happy to drop you a link as well, whereby you can watch over it again if you so feel obliged to do that. Okay then, good luck and good luck with the glaucoma patients and have a really good evening. Take care now. Bye-bye.